Can you talk a little bit about the state of health and healthcare systems in this country? I mean, it's in the TV news uh, all the time about, Obamacare, I guess is the latest thing, but you can talk about that a little bit, about the state of this country.
I think the state of um, healthcare in our country is really fundamentally a reflection of our philosophy. We don't do a good job as a society of getting down to the root issues.
Mm.
Um, we don't actually have a healthcare system, do we?
Mm.
We have a sick care system. And so if we pay doctors and hospitals to treat sickness, then from an economic standpoint, it shouldn't be really surprising that we have more and more sickness. So I had a trainer when I was in medical school, and he was a physiatrist, and he was talking about workers' compensation. And he said, Jamie, if you pay a man not to work, he will not work. So if you pay me as a board-certified OBGYN to take out uteruses, to do laparoscopic surgery for pain, to prescribe drugs, and I have a family to feed, I'm just like you and everybody else, right? What am I going to do? I'm going to do those things. I'm going to do that which I was trained to do. So I think fundamentally, if we want to really change our sick care system into a health care system, we need to pay people to keep us well and stop paying them when we're sick. And I think the Chinese do that. I think the Chinese medical model is you pay me while you're well. And when you get sick, I haven't done something right. And therefore, you stop paying me until I get you well again. Imagine what that would do to revolutionize health and well-being in America.
How much of that has to do with the shift in how patients think too, though? They don't go to anybody unless they need to. They don't, right now, we don't go to a physician to maintain wellness.
Right. So you look at the history of that maybe. And I'm no historian. I don't want to purport that I really have validated this in some objective way. But it kind of makes sense to me. I was listening to a lecture from a gentleman in the 1920s, and he was proclaiming in this lecture, he wasn't a medical person, he was a businessman, that science and medicine had basically cured infectious diseases. And, it's an interesting perspective, and he was kind of right. Now, they didn't know about antibiotic resistance that would be emerging and such, but they didn't have chronic disease then. They had infectious disease. You died because of a sanitation issue or a trauma or some type of infectious disease. Well, nobody, quote unquote, nobody dies of those things anymore. I mean, they do, but we're all suffering from this mysterious chronic disease thing. Well, why? Well, everything about the way we lived has changed. We don't eat food anymore. We don't sleep well. We have multiple aspects of toxicity in our environment. And I think that we've had the added effect of these things in our society, and that's why people are not well. And it's complicated. It's hard to trace it back. Obesity in 1990, there was no state in the U.S. that had more than a 20% obesity rate. 2010, according to the CDC, there is no state that has less than a 25% obesity rate. What's happened? You can't tell me that everybody's just eating lots of calories. That doesn't make sense. And in fact, the ancestral people group studies would support that. There's ancestral people group studies, meaning people groups that are alive now that have been eating the same way for forever. Okay, and some of these groups eat 60% fat. Some of them eat 60% protein. Some of them eat 70% carbs. Some of them eat 17% saturated fat. None of them have overweight. None of them have obesity. They're lean. They don't have atherosclerotic disease. The men don't get hypertension in their 50s. Why? It's not because they're running around the rainforest, tackling alligators. That's not it. It's because they're not inflamed. And when you take someone within those people groups and they start doing some more Western-style agriculture, and I'm not talking about John Deere tractor, 100,000 acres of grain agriculture, but they go over here and they start doing a little bit of modern farming. They don't get sick, they don't get overweight, they don't get obesity, but they do bump their leptin levels. And leptin is a hormone that's involved in probably a lot of things, but one of the things is your your hunger centers and your feeding behaviors. And so they bump their leptin level, which means they've become a little bit leptin resistant. And that's really one of the first hormonal signs that you are heading down the path toward metabolic disease. When you take one of those people, one of those ancestral people group individuals, and you put them in a Western style diet, they become overweight and become obese, and they get metabolic disease very quickly.